Have you ever had a good night's sleep and suddenly had a cramp that made you wake up in the middle of the night, grabbing your calf and groaning in pain? Or every time you walk for more than 10 minutes, your leg aches like it's being pulled? If this happens regularly, it's no small matter. A recent survey from the American Institute on Aging found that more than 65% of people aged 60 and older experience leg cramps at least once a week, especially at night. And 3 out of 4 people said they felt muscle aches after sitting for a long time or doing light activities like shopping or climbing a few stairs. Dr. Lisa Raymond, a musculoskeletal specialist at the Mayo Clinic, revealed that after age 60, your muscles and ligaments become less elastic. When they don't get regular light exercise, they become stiff and prone to spasms, leading to cramps and pain. Frank, a 74-year-old man living in Ohio, shared, "Every time I walk for more than 15 minutes, my legs feel tight. But after doing a few simple exercises every day for 10 minutes, I almost no longer feel the pain anymore." The problem here is that many people believe that muscle pain and cramps are normal in old age, so they ignore and do not treat them. But the truth is, with a few light and regular exercises, you can prevent up to 80% of muscle pain and cramps after age 60. In the next section, you will discover the first simple exercise, the exercise that doctors at Harvard University recommend that older patients do every morning when they wake up. Exercise 1. Laying down calf stretch. Cramps often occur at night because the calf muscles shorten and lack blood flow while you lie still for hours, says Michael Grant, Ph.D., a physical therapist at Johns Hopkins. A simple stretch before getting out of bed can prevent cramps from occurring just minutes later. The first thing you should do every morning while you're still in bed is a passive calf stretch. How to do it? Lie on your back with your legs straight. Slightly lift your heels off the bed and point your toes toward your head, creating a gentle stretch in your calves. Hold this position for 15 to 20 seconds, then relax. Repeat 3 to 5 times on each leg. If you find it difficult to hold your leg in this position, you can use a thin towel, wrap it around your foot, and gently pull it toward your body. This helps stretch your calf without putting pressure on your knee or ankle. A 2021 study published in the Journal of Geriatric Physical Therapy found that people 65 and older who did calf stretches every morning for 3 weeks had a 62% reduction in nighttime cramps. They also reported less leg fatigue after walking and less numbness when changing positions. Mary, 68 years old, of Oregon, said, "I used to get cramps so bad that I didn't dare stretch in my sleep. But after my doctor showed me how to do this exercise, I did it every morning, and for 5 weeks now, I've had no pain at night." An important point to note: don't stretch too hard. If you feel sharp pain or muscle twitching, ease up and rest. The goal is to maintain muscle flexibility without injuring it. In addition to preventing cramps, this exercise also helps improve blood circulation to the lower extremities. This is extremely important because many older people suffer from peripheral ischemia without knowing it. When blood circulation is good, the muscles receive enough oxygen and nutrients, so they function more smoothly and are less likely to cramp. A little tip from Dr. Grant: combine this calf stretch with drinking a glass of warm water first thing in the morning, as dehydration is also a common cause of cramps in older people. After successfully stretching your calves, what is the next exercise you should do as soon as you get up? In the next section, you will learn a gentle movement that can help increase flexibility in the hip joint and reduce the feeling of heaviness in the legs, especially if you often have numbness or swelling in the ankles. Exercise 2. Rotating the ankle while sitting. Many people over 60 experience swollen ankles, numbness in the legs, or a feeling of heaviness in the calves when sitting for long periods of time, especially after watching TV, reading, or driving. These symptoms are signs that blood circulation in the lower extremities is decreasing, and the small muscles around the ankles are gradually becoming stiff. Henry Wallace, MD, a circulatory specialist at the Denver Heart Institute, explains, "The ankle is one of the weakest points as people age. It easily stiffens, loses flexibility, and that directly affects the way you walk and maintain balance. Rotating the ankle joint every day will help pump blood more efficiently from the legs to the heart, while also preventing cramps." The sitting ankle rotation exercise is extremely simple, but brings noticeable results after a few weeks, if performed regularly. How to do it? Sit up straight on the edge of a bed or chair with a backrest. Lift one leg off the floor, keeping your knee slightly bent and relaxed. Rotate your foot in slow circles, 10 times in each direction. Then switch legs and repeat. You can combine this movement with deep breathing to increase blood circulation throughout your body. A little tip is to rotate very slowly, focusing on feeling each joint move instead of doing it quickly. According to a survey from the American Physical Therapy Association, 78% of seniors who do this ankle rotation exercise every day said they have less numbness in their feet and no longer feel heavy when walking, especially at the end of the day. John, 72 years old, lives in California, used to use a cane when going to the market because his feet often felt numb and he could easily lose his balance. But after attending a community rehabilitation class for 2 months, in which the first exercise every morning is to rotate the ankle for 10 minutes, he said, "I feel my legs are lighter, no longer swollen, and importantly, I walk more confidently." Another unexpected benefit of this exercise is that it helps control peripheral blood pressure, because when the ankle moves regularly, it helps the peripheral vascular system work effectively, thereby avoiding blood clots or increased pressure on the vessel wall, the silent cause of stroke or heart attack. However, Dr. Wallace also warned, if you feel your ankles making a clicking sound or a sharp pain when rotating, you may have mild arthritis or an underlying injury. In that case, you need to reduce the number of rounds and consult a rheumatologist. Combining the ankle rotation exercise with calf stretching, as in the previous section, is a way to help the muscles, joints, and blood vessels in the legs operate smoothly, thereby significantly reducing the possibility of cramps. Next, we'll look at an extremely gentle exercise that can be effective in reducing knee stiffness, something many people face every morning after age 60. Exercise 3. Knee bending on a chair. As you approach your 60s, one of the first things you'll notice is that your knees start to feel stiffer in the morning. Getting up and down becomes a bit more difficult. Some people describe feeling as if something is stuck in their knee joints as they stretch their legs. This is a classic sign of decreased lubrication and mild inflammation in the knee joint, which causes the cartilage to dry out and become less flexible. According to Dr. Stephen Howard, a rehabilitation specialist at the University of Michigan, we recommend that seniors do some light exercises to maintain joint lubrication before resorting to medication or considering surgery, he says. The chair knee extension exercise is one of the top recommended exercises in rehabilitation programs for seniors. How to do it? Sit upright in a sturdy, non-wheeled chair. Place your feet flat on the ground, perpendicular to your shins. Slowly lift one leg, extending it straight out in front of you, parallel to the ground. Hold for 2 to 3 seconds, then slowly lower your leg back to the starting position. Repeat 10 times for each leg. If your knees are showing signs of weakness, you can start with 5 times, then gradually increase each week. This exercise helps stimulate synovial fluid production while strengthening the quadriceps, the main muscle group that supports the knee. A study published in Geriatric Orthopedic Surgery and Rehabilitation in 2020 found that older adults who practiced knee flexion and extension exercises at least 4 days a week for 6 consecutive weeks had a 38% improvement in knee flexibility and a 55% reduction in pain after sitting for a long time. Barbara, 69 years old, used to use a cane when going out because her knees were no longer stable. But after being taught this exercise by her daughter, a physical therapist, and monitored every week, she gave up the cane after only 2 months. I didn't expect that just sitting in a chair and stretching her legs would have such a big effect, she shared. In addition, this exercise also reduces the risk of falling because it helps improve motor control and coordination between muscles and joints. In the elderly, falls are one of the leading causes of death due to bone complications. Dr. Howard notes, if you feel a popping sound when you stretch your knee, but it doesn't hurt, it's just a normal sound due to gas in the joint. But if there's sharp pain or swelling, stop exercising and see a professional for an evaluation. After softening and strengthening your knee, in the next section, you'll learn an exercise that stretches your thighs and hamstrings. 2 often forgotten muscle groups that are key to preventing back pain and improving the way you walk. Exercise 4. Thigh and hip stretching, standing against a wall. Many older adults focus too much on their feet and knees, forgetting that the thighs and hips are where all lower extremity movement begins. When you walk, sit down, stand up, or climb stairs, it's the hip and quadriceps that determine how smoothly you move. Dr. Rachel Miller, a geriatrician at the Cleveland Clinic, explains, the hip and thigh muscles become tight after years of sitting and little movement. When not stretched regularly, these muscles can pull on the knees, causing lower back pain and increasing the risk of cramps, especially at night. The wall-standing hip and thigh stretch is recommended by physical therapists because it is simple, safe, and easy to adjust to each person's strength. How to do it? Stand next to a wall or lean against the back of a chair for balance. Bend one knee back, using the hand on the same side to hold the ankle. Gently pull the foot toward the buttocks. You will feel the quadriceps being stretched. Hold for 20 to 30 seconds and relax and switch legs. Do 2 to 3 times on each side. If you have knee pain or difficulty balancing, you can use a cloth strap or soft towel to hold your foot instead of bending over. A 2022 study at the University of Pittsburgh found that daily stretching of the thighs and hips significantly improved balance and reduced the risk of falls by 41% in people over 65. Robert, 73 years old, had suffered from chronic lower back pain for years. But after his doctor taught him this exercise, and he did it every morning for 3 months, his back pain disappeared. I didn't think the thighs were related to back pain until I felt the change in my own body, he says. A little-known benefit, this stretch also improves blood circulation in the pelvis and legs, which is especially important if you sit a lot or have peripheral vascular disease. Dr. Rachel also notes that you should breathe slowly while stretching, avoiding holding your breath, which can increase blood pressure. And always keep your knees bent straight, avoiding leaning outward or turning your legs the wrong way. Up to this point, you have learned 4 basic but extremely effective exercises to help prevent cramps, improve joint flexibility, and reduce muscle pain. In the next part, the final part, you will discover 2 simple exercises to help activate blood circulation throughout the body and calm the neuromuscular system, especially suitable for doing before going to bed. Exercise 5. Light heel raises in place. This is a movement that simulates the movement of the calves when you walk, but does not put pressure on the joints. Its effect is to stimulate blood circulation, warming up the muscles before resting. How to do it? Stand up straight, hands holding on to a wall or chair for balance. Slowly raise your heels. Put your weight on the balls of your feet. Hold for 2 seconds. Slowly lower your heels. Repeat 10 to 15 times. You can do this exercise after dinner or before brushing your teeth. If you can't stand for long, do a seated version by sitting in a chair and raising your heels off the ground, which still has the same effect. A 2023 survey by the American Cramp Prevention Association found that people who did this heel raise for 10 minutes A day for 4 weeks had a 54% reduction in nighttime cramps and significantly improved sleep quality. Exercise 6. Gentle feet shake while lying down. This is the simplest exercise. You can do it while lying in bed, getting ready for bed. It helps release the neuromuscular tension after a day of activity and reduces excessive contraction signals from the nervous system to the calves. How to do it? Lie on your back with your legs comfortably extended. Slightly lift one heel off the bed and gently shake your foot back and forth in a small range, about 10 to 15 seconds. Repeat with the other leg. You can do 2 to 3 rounds per leg. Dr. Amanda affirms, this small movement triggers a deep relaxation mechanism in the motor nerves, very similar to the hammock effect in infants, gentle but extremely effective. Carol, 75 years old, living in Minnesota, used to suffer from cramps so much that she was afraid to go to sleep. But after attending a yoga class for seniors, she regularly applied this leg-shaking exercise every night. I do this movement in silence, with dim lights, and feel like all the tension in my body is shaken off. A special advantage of this exercise is that it does not require standing up, does not require equipment, and is suitable for people recovering from strokes or minor leg injuries. Exercise 7. Lightly wave your arms and legs while laying down. One exercise that elderly people in Japan and Germany use every day to activate the motor nervous system and improve circulation throughout the body is the lying down arm and leg swing. It sounds silly, but it is surprisingly effective. Dr. Takeshi Aoki from the University of Tokyo, in his research on the health of people over 70, said, when you gently shake your arms and legs together for a few minutes, the body enters a state of passive movement, helping to improve coordination between the brain and muscles. This is a simple way to refresh the nervous system without putting stress on the joints. How to do it? Lie on your back on a flat surface, such as a bed or yoga mat. Gently lift your arms and legs off the bed, keeping your elbows and knees slightly bent. Start shaking your arms and legs gently, as if you are shaking them to get the blood flowing throughout your body. Do this for 1 to 3 minutes, breathing evenly and feeling your entire body moving gently. Main benefits: stimulates blood circulation throughout the body, reduces signals of stiffness from the peripheral nervous system, calms the sympathetic system, the system responsible for creating the stress response in the body, contributes to regulating heart rate and sleep. A 2022 study in Munich of 320 people aged 6582 found that people who did this hand-foot shaking exercise every night before bed reported a 68% higher level of relaxation and a 49% reduction in back pain or leg cramps within 3 weeks. Walter, 70 years old, living in Florida, shared, I suffered from insomnia for many years due to stiff back and thighs. But since a Japanese friend taught me this shaking exercise, I have been able to sleep easier and my body feels lighter every morning when I wake up. Note: this is a gentle exercise that does not cause fatigue. If you feel dizzy, put your arms and legs down immediately and try again the next day for a shorter time. Exercise 8. Bed cycling to make joints flexible and prevent stiffness. Many elderly people often have stiff hips and knees after a long night's sleep. This makes walking in the morning difficult and can easily cause loss of balance. One exercise recommended by many rehabilitation doctors is bed cycling. Simple, gentle, and extremely effective. Recumbent cycling is a great way to warm up your entire lower extremities without putting stress on your back or joints, says Ethan Reed, MD, a geriatrician at the Mayo Clinic. For older adults, it's a great way to loosen up your muscles in the morning and prevent cramps at night. How to do it? Lie on your back in bed with your arms at your sides or under your buttocks to support your lower back. Raise your legs, knees slightly bent. Start as if you're pedaling a bicycle. Pedal slowly and rhythmically for 30 to 60 seconds. Breathe evenly throughout. If you get tired, rest for a few seconds, and then do another set. You can pedal forward, then reverse to activate more muscle groups. Benefits of this exercise: reduces stiffness in your knees and hips after sleep, increases flexibility in your groin, which can help you walk more easily, reduce the risk of leg cramps and numbness due to sitting for a long time or lying in the wrong position, slightly increase heart rate, suitable for activating light circulation in the morning. A 2020 study from Stanford University followed 118 people over the age of 65 who performed a simulated cycling exercise for 5 weeks, and found that more than 70% of participants reported a significant reduction in leg numbness, stiffness, and feeling of heavy legs in the morning. Many also noted that they were more mobile in their daily activities. Betty, 76 years old, from Texas shared, "It used to take me up to 15 minutes every morning to stretch my legs, sit up, and get out of bed. But since doing this cycling movement for 1 minute every morning, I wake up easier. My legs feel lighter, and I no longer stumble when walking like before." Small note: do not lift your legs too high, and do not do it quickly. This is a gentle movement, does not use force, does not squeeze the knees or spine. If you have a history of herniated discs, consult your doctor before doing this. Exercise 9. Full body leg extension in bed to stretch the sciatica nerve. If you have ever felt pain radiating from your lower back down the back of your thighs and all the way to your calves or ankles, you are not alone. More than 40% of people over the age of 60 experience this condition, and the most common cause is strained sciatic nerve and hamstring muscles. Dr. Laura Simmons, a neuromuscular specialist at UCLA, shares, when the nerves in the lumbar region, especially the sciatic nerve, are improperly compressed or stretched, you will feel pain running down your legs, especially when standing up or lying down for too long. The full body leg extension is a simple way to unlock this neuromuscular system without the need for intensive physical therapy. How to do it: lie on your back on a bed or soft mat. Bend one knee toward your chest, holding your hand behind your thigh or just below your knee. Slowly straighten your bent leg out in front of you, keeping your knee slightly bent if it is too tight. Hold for 10 to 20 seconds, feeling a gentle stretch in the back of your thigh and calf. Release and switch sides. Do 2 to 3 reps for each leg. Important: do not stretch to the point of pain. The goal is to feel a gentle stretch, but not a sharp pain. If you have a history of acute sciatica, start very slowly and see how your body responds. Benefits: stretch the hamstrings, which are prone to shortening after age 60. Relieve pressure on the sciatic nerve, the culprit behind numbness, tingling, and cramps that run from the back down the leg. Increase leg flexibility, helping you walk steadily without stopping mid-step due to sudden fatigue. Calm the peripheral nervous system, thereby reducing muscle tension at night. A study by the American Academy of Neurology found that the correct leg stretch reduced the frequency of sciatica and nighttime cramps by up to 58% after just 4 weeks. Catherine, 71 years old, from Arizona, used to be unable to stand for more than 5 minutes because of the pain that radiated from her lower back to her heels. After her internist son taught her this exercise every night before bed, she said, "Not only did my pain lessen, but my legs felt lighter every morning, and I no longer struggled to get up like before." You can combine this exercise with a gentle shaking movement to relax your nerves and release your muscles, especially before going to bed. If you find these exercises too simple to believe, try them today. You don't have to do them all at once. Just start with 1 or 2 that you find easiest. After a week, you will see a clear difference. Less pain in your legs, more flexibility in your muscles, and deeper sleep. Don't let age steal your initiative. Just a few minutes a day, you are giving your body back the chance to recover and giving your feet the right to walk comfortably for the rest of your life.